Hi, I'm Stephanie Lucas. My presentation is Delayed Antibiotics to Prevent Antibiotic Overuse. Defined healthcare problem. Antibiotic overuse is the main contributor for the development of antibiotic resistance. Resistance results when antibiotics become less effective in killing infectious organisms because those organisms have adapted to the drugs after long-term and inappropriate use. Primary care is increasingly becoming the focus of antimicrobial stewardship and the fight against the global crisis of antibiotic resistance. Primary care providers are the biggest prescribers of antibiotics, perhaps 3/4 of all used in medical care. And respiratory tract infections are the group of infections most commonly treated. According to Delmar, respiratory tract infections are spontaneously remitting illnesses often caused by viruses. Treating these viruses with antibiotics only leads to an increase in resistance to these life-saving drugs. Importance of the problem. According to the Centers for Disease Control and Prevention, antibiotic-resistant infections are a substantial health and economic burden to the U.S. healthcare system, as well as to patients and their families. The CDC reports that each year in the United States, at least 2 million people become infected with resistant bacteria, and at least 23,000 patients die each year as a direct result of these infections. Those organisms currently in the urgent hazard level, per the CDC, are C. diff, CRE, which is carbapenem-resistant Enterobacteriaceae, and drug-resistant gonorrhea. And all of these results from antibiotic overuse and misuse of antibiotics. Research studies. The first study I looked at was by Little et al. They completed a randomized controlled trial looking at delayed antibiotic prescribing strategies for respiratory tract infections in primary care. Their methods include an intervention group where patients did not receive immediate antibiotics but were randomized to 4 delayed prescribing strategies, which did include a no prescription given group. Their inclusions were patients aged 3 years and over diagnosed with acute respiratory tract infection from primary care practices in the UK. The study looked at symptom severity, 0 to 6 on the Likert scale, during days 2 through 4, which were deemed the worst days for illness. The results showed that in the delayed and the no prescription group, there were no significant effect on symptom severity. And in the immediate prescription group, there also was no significant effect. In this trial, there were many strengths, and limitations were listed as recruitment was slow due to time pressures of busy winter season. Some of the logs for non-recruitment were poorly completed. The study was pragmatic, so patients were free not to comply with the advice, but compliance was deemed reasonable, and complications were limited. In this randomized controlled trial, we found that this trial would be feasible and reasonable to use in practice as it is centered around delaying antibiotics and managing patients' symptoms as a way of combating antibiotic overuse. The study did not confirm poor symptom control with delayed antibiotics, but did confirm that using delayed prescribing had no effect on symptoms and did result in a 40% fewer antibiotics. The second study is by De La Posa Abad. They did a randomized controlled trial looking at prescription strategies in acute uncomplicated respiratory infections. Their method also included an intervention group where patients were randomized to 1 of 4 delayed prescription strategies, and they also included a no prescription strategy group. Their inclusions were patients aged 18 years and older diagnosed with uncomplicated respiratory tract infections in 23 primary care centers in Spain. The study looked at symptom severity, also on a Likert scale of 0 to 6, and duration of symptoms. Their results were symptom severity showed a mean of 5 for all strategies, and delayed strategy groups showed slightly greater symptom duration, but the differences were not clinically relevant per the researchers. And also in this study, there were many strengths, and their limitations were listed that they did not achieve target sample size due to running out of funding due to slow recruitment. And they thought that the open nature of the study could have caused a placebo effect favoring antibiotics. But this effect was minimized by the similar structured information all patients received about self-limiting nature of respiratory tract infections and the advice about non-antibiotic medication use. There were no complications or harms reported. In This randomized controlled trial, they found that delayed antibiotic prescribing strategies are a useful approach to manage patients with acute uncomplicated respiratory tract infections. This study of antibiotic treatment for respiratory tract infections showed that delayed prescribing were associated with slightly greater but clinically similar symptom burden and duration. It did show substantially reduced antibiotic use and therefore makes the case that delayed strategies should become standard practice as they reduce antibiotic use and patient belief in antibiotic effectiveness. Improving advanced nursing practice. Advanced practice nurses could use this information presented in their care of patients with uncomplicated respiratory tract infections, which is one of the most common ailments of patients seeking treatment. Symptom management should be a top priority in this patient population as a way of decreasing unnecessary antibiotic prescribing. Proposed intervention for advanced nursing practice. A proposed evidence-based intervention to help combat the problem of antibiotic overuse would be to consider delayed prescribing of antibiotics, in addition to symptom management for the treatment of uncomplicated respiratory tract infections. We need to educate patients on the complications of unnecessary antibiotic use, such as risk of developing antibiotic resistance and other infections, as well as developing C. diff associated with antibiotic use. We need to give information to our patients regarding ways of managing symptoms resulting from a respiratory tract infection, such as rest, fluids, over-the-counter medications to alleviate discomfort, and over-the-counter cough medications if indicated. Intended healthcare environment. In the primary care setting, it is important for the advanced practice nurse to be aware of the complications associated with unnecessary antibiotic use. Primary care is increasingly becoming the focus of antimicrobial stewardship in the fight against the global crisis of antibiotic resistance. As you can see, we need to combat drug resistance because no action today equals no cure tomorrow. And unfortunately, no amount of antibiotics will get rid of your cold. And as this says, the best way to treat most colds, coughs, and sore throats is plenty of fluids and rest. Thank you.